7:23 now. It's NOLA HIV Awareness Week, and World AIDS Day is coming up, I believe, this Thursday. And while there's been a tremendous amount of progress in treatment and the prevention of HIV and AIDS, there are a number of challenges that remain. And we are joined this morning by Dr. Richey, the Associate Professor of Medicine at LSU Health and Medical Director of the HIV Outpatient Program at UMC. Dr. Richey, good morning to you. I was kind of surprised to read that after a lull, the number of cases is actually rising.
So we've had a decrease in HIV diagnoses in Louisiana for several years, and then the numbers came back for 2021, and we have had a relatively dramatic increase, a 29% increase over 2020.
Was there some complacency, perhaps, or is it a cycle, or what happened here?
I don't think we know for sure, but I suspect that a lot of people did not seek care during the COVID-19 pandemic, and that may have resulted in both people not getting the diagnosis of HIV and also people who have HIV not receiving proper care, and as a result having an elevated viral load and transmitting the virus to other people.
Obviously there is not a cure, but I think a lot of people have been under the impression that we sort of had this under control, or in a bit of a box anyway. So where would you say things stand?
Well, we have a lot of people under control. Our goal is to have 90% of the U.S. population that has HIV to have their virus suppressed. But the remaining people that we need to diagnose and get on treatment tend to be some of the more challenging patients to reach because of their social situation or otherwise. But we definitely have the tools to end this pandemic. It's just whether we can implement all those tools and make it happen.
That's what I was wondering. So you believe that ending HIV and AIDS is actually within reach? It can be done?
I think it can be done. It's going to take more infrastructure and more work, but we have pre-exposure prophylaxis PrEP to prevent people from getting HIV, and we have treatment as prevention. So when we treat people with HIV, they don't transmit HIV to their partners. So if we could find everyone who has HIV, or everybody to know their status, then we would be able to basically halt the epidemic.
Sure, I know you believe it's important for people to know their status and that sort of thing. In the last half minute that we have here, if you would, tell us a little bit about the services that are offered at the HIV Outpatient Program.
So HOP, or the HIV Outpatient Program, is at University Medical Center in the outpatient care building. It's a comprehensive care clinic. We have primary care, specialty care, psychiatry, psychology, dental, basically a full service clinic. And we are able to provide care regardless of people's ability to pay. So anybody who is out there that knows they have HIV or needs services, please reach out to us. You can reach us through the UMC operator or through our direct clinic number.
All right. We appreciate your time this morning, Dr. Richey from LSU Health.